Why does cryptogenic stroke increase future stroke risk? Imagine a stroke happening, and doctors can't quite find the reason why. That's what we call a cryptogenic stroke. It's a type of ischemic stroke where the cause remains a mystery even after thorough testing. Because the root cause isn't clear, it makes preventing another stroke more complicated. The unknown origin often hides underlying issues that can raise the chance of having another stroke later on. One big reason is that many cryptogenic strokes are believed to come from hidden conditions that are hard to detect. For example, some people have episodes of atrial fibrillation, which is an irregular heartbeat that can come and go without symptoms. This intermittent atrial fibrillation can cause blood clots to form in the heart. These clots can then travel to the brain and cause a stroke. If this condition isn't caught because the episodes are brief or infrequent, the person might not get the right treatment, like blood thinners, which are more effective than standard blood thinners for preventing strokes caused by atrial fibrillation. Another common hidden cause is a small hole in the heart called a patent foramen ovale. This hole is present in about a quarter of adults and can allow blood clots from the veins to bypass the lungs and enter the brain. When this happens, it can cause embolic strokes, which are caused by clots traveling through the bloodstream. If this hole isn't detected and closed when appropriate, the risk of future strokes remains higher. There are also other less obvious causes, like tiny plaques in the aortic arch, which is part of the main artery coming out of the heart. These plaques can shed small pieces of material that travel to the brain and cause blockages. Blood clotting disorders, known as hypercoagulable states, can also be behind some cryptogenic strokes. These conditions make the blood more likely to clot, increasing the chance of a stroke without obvious signs. Diagnosing these hidden causes can be tricky. Standard tests might not catch intermittent atrial fibrillation or small cardiac abnormalities. That's why doctors sometimes recommend prolonged monitoring, like implantable loop recorders, which can stay in the body for weeks or months to catch irregular heart rhythms. Similarly, testing for a patent foramen ovale or blood clotting disorders may require specialized procedures. Because the cause remains unknown, treatment can be less targeted. If a stroke was caused by atrial fibrillation, blood thinners are usually recommended to prevent recurrence. But if the cause isn't identified, patients might be given medications that aren't as effective for their specific situation, which can leave them vulnerable to another stroke. The reason cryptogenic strokes increase future risk is because they are often caused by underlying issues that are difficult to detect initially. Without identifying and treating these hidden causes, the risk of having another stroke stays high. That's why ongoing evaluation, including advanced monitoring and testing, is so important. It helps doctors find the true cause and tailor prevention strategies to each individual. If you or someone you know has had a cryptogenic stroke, it's essential to work closely with healthcare professionals to explore all possible hidden causes and reduce the chance of future strokes.